Hi, I'm Dr. Elizabeth Smith with Balanced Living Counseling Services. Thank you, MSU, for inviting me to your Minority Healthcare Providers Symposium. And so I look forward to finding out how well it went and all the good things that have come out of it. So I was asked to talk about mental health. So minorities representing mental health. And so I have my colleague here, Miss Sarah Scott, who will be asking me some questions, and we're going to just talk a little bit about mental health and how it has affected us, as well as how it's affected our people and other underrepresented populations. So we'll get started.
Can you tell me about your education and your training?
Okay, so I have an eclectic background when it comes to education. So I started off with pre-pharmacy, and after working in pharmacy, working as a pharmacy tech for many years, and well, I say many, but a few years, I went into, was going to do pre-med, ended up going to Oral Roberts University just after I graduated. And one of the things I realized when I switched from pharmacy in the first place was that when people were coming to get medication, that a lot of times they were dealing with socialization issues, family issues, relationship issues. And so throwing medicine at it wasn't a solution. And eventually I felt like I needed to be where my call was to help people in that area. So long story short, I ended up going to Oral Roberts University to get my master's in Christian counseling. So I got my master's in Christian counseling. I took the emphasis or courses in marriage and family therapy, as well as taking all the courses for substance abuse. So in my internship, I worked at my first internship up there. I worked in the residential treatment facility for addicted mothers with their children, which is very unique. So that was awesome. So I did that, and eventually came back here to Mississippi and worked and did my 2 years eventually. I did my 2 years of supervision and the 3,000 plus hours that you need to have, and got my LPC. That's a short version. And eventually my PhD is not in psychology. I might go back and do that, just FYI. But right now, my PhD is in education. So I do a lot of psychoeducation, as well as, working with people on mental health issues. So that's a long story short. My work experience when it comes to training, even when I was in Tulsa, I worked in the residential treatment facility. I worked in correctional facilities, providing moral recognition therapy because I got certified in it. Worked in a group home for sexual offenders, teen sexual offenders. Worked in a group home for just children for various issues. And then coming here, I also worked at a women's prison, and I did substance abuse assessments. So coming here, back home, I worked in IOPs, PHPs, partial hospitalizations, intensive outpatient programs, intensive youth programs. When I first came back, one of my first jobs was working on a state program, a state grant program for a prevention program to keep kids from being adjudicated into the court system. So that was a lot. And I did that from renovating the buildings to picking out the colors, to picking the curriculum, to hiring all the staff. And we worked with the kiddos in the schools, as well as at the homes, and did home-based counseling. We also saw them 3 times a week in the office. So that was intensive. So I did an intensive with geriatric population, senior elderly population with basic severe mentally ill. Did a lot of that. Also did home-based counseling when I was in Tulsa. So did a lot. Did a lot of work. So my last job, I started private practice 2008, and I started working 2014 with the Military Family Life Counseling Program, call it MFLAC for short. So I've been doing that type of work also along with private practice since, the Military Family Life Counseling Program since 2014. So a lot of different dynamics. But it's taught me a lot. It's taught me a lot.
Okay. What would someone need to do to enter into the mental health field?
Well, I tell you, one of the things that we have learned when working with in this population and going to school, I'm an LPC, licensed professional counselor, meaning you have a counseling degree or a counseling psychology degree or a psychology degree. There are a lot of different lobbying issues and dynamics related to an LPC. So a lot of roadblocks. I've had colleagues that have been very frustrated trying to do private practice with me, and insurances for various reasons. And I say lobbying and politics has played a part in kind of blocking the LPC practitioner. Some you go through the same rigor, you go through the same 2 years, but it's an issue. It can be a roadblock for federal jobs. Even though President Obama allowed LPCs to be able to see military and be readily available to provide services. It's kind of been hard. It took a long time to get there. Medicaid is finally allowing us to provide, but not Medicare. So some people choose to do the LPC. They just want the master's and they're fine. They don't care if they have those roadblocks. They would prefer. Kind of like what you decided. Because I tried to talk you into doing social work. You're like, nope, I'm going to do exactly what you did. So some people, I do recommend, if you don't want those roadblocks, if you think you're going to work for a government agency, they do get paid well and better. I don't think that academically it's any better. I just think it's because of politics. Then I would just say do the social work. Then when you graduate, you still got to do your 2 years of supervision. After you graduate, still have to take your test. But then you have your license. So you can be a master's in social work, get your do your 2 years and everything, take your test and your LCSW. Whereas if you don't, you can do the LPC route. You obviously have the LMFT, the licensed mental health therapist, as well as the licensed substance abuse counselors. The other thing is go all the way. Get your PhD in psychology. Become a psychologist. That's what I recommend. I love psychology and the study of it. And so when you're doing interviews, when CNN is interviewing somebody, do they say, hey, we have local social worker so-and-so? Or do they say, we have psychologist so-and-so here, expert in blah, 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 and they're going to answer these questions about mental health. So why not? Go all the way. You know, we don't have any roadblocks. Do you go all the way and get your PhD in psychology? So that's what I recommend.
So what trends of the unrepresented population accessing mental health have you found?
Trends for assessing mental health populations or underrepresented populations. Some of the trends that I have seen, one of the things is because, one of the things is stigma, right? Our people, but not just African Americans, but brown people, various people, underrepresented populations. We kind of been apprehensive, even just, poverty level, or even, and it don't even have to be poverty, military. We all have, somebody has a thing, I'm not strong if I have to go to counseling, or I'm not weak, or I'm not crazy. So overcoming those stigmas, it has, over the years, has gotten better. One of the things I think, one of the reasons why it has, people have been kind of overcome whatever has been keeping them from accessing mental health. One of the things is healthcare. I saw a drastic change with the Affordable Care Act. And so when the Affordable Care Act was passed, Obamacare, it allowed accessibility. So now that a lot of minority people, individuals have access to mental health, then they're able to take advantage. The other thing is we've had a lot of life events, whether it's natural disasters, like Katrina or 9/11, or, fires and tornadoes and different things that have caused, trauma. You've heard about and heard it spoken about taking advantage of mental health. Another thing, those are natural disasters, but shootings, Lord, around that time we had a lot of shootings, and unfortunately it kind of came back up again with people targeting Asian Americans because of COVID-19. But you know, when you've had these type of shootings and traumatic events, people are taking advantage of it because you hear it in media, you hear it in the news, and they talk about the importance of it. Even life events like Meghan and Prince Harry, you know, and him bringing it to the forefront. I think something that was great, I love this quote that he said. They were interviewing him after the Oprah interview, and he was saying that he's going to, you know, join the Better Up organization in mental health and doing some type of work. And, you know, everybody knows his story and the trauma that he has gone through with the death of his mother. And he talked about he has learned how to use his pain to find his purpose, or to push him into his purpose. And so many of us in the mental health field have done that. I just say one important thing about that is to do your work. Because we don't want to hurt anybody. We don't want to go in jacked up. I know that's a very technical term. We don't want to be all jacked up and hurting other people. So we have to do our work. We need to physician heal thyself. You need to go get your counseling. And sometimes I have had clients, they thought it was awesome, you know, and the mental health that they were received, and they thought they should go into the profession. I'm like, no, I don't think so. You know, not everybody should go into mental health. You can admire it, you can advocate for it for other people, but sometimes you may not necessarily be the one that needs to go into it. So you need it's important to do your own work and to really make sure you have your own mental health care. We all need to do that, yes. Even as providers. And so those are some of the things that I recommend. And one of the things that I wanted to bring up is just, you know, as African American people, as minorities, we have experienced so much racism, prejudice, trauma, racial trauma, with Black Lives Matter, with the police brutality and the deaths and the marches and the political climate. That can't go unnoticed. So I have a lot of people, African American, that come to me because, yes, they need to see themselves. They need someone to come to them who understands their plight, to understand what they're going through, yes. And be able to help them, you know, where they are. Not going to judge them, not going to say, well, I don't understand, but I'll try to help you. But someone that can actually help them. So that's why it's important for us to get in there, yes. And be to be accessible, you know, to our own and to others, you know, and being open to people who are in need of any type of multicultural situation that they're in. So Miss Sarah, do you have anything that you'd like to add about this discussion?
Well, I would like to add that I see a lot of time in the minority that they feel pressed down, like they don't want to be able to go receive mental help, almost as if they feel like they're going to be discriminated against just because they have to receive mental help. What do you think they should do in order to be able to move forward in receiving mental help when it's needed?
Mm-hmm. I think that's very obvious, and it's something not only with mental health, but in the healthcare field. You know, we talk about the disparities, or the disparities have come out as a result of COVID-19 treatment in 2020, and so mental health is no different. You know, I think people have been, we as a people, underrepresented populations as a people, have been pushed down and maybe brushed to the side, or felt like, you know, just kind of get over it, you know, and you'll be okay, you know, or just even in the church. We've got to deal with the church. You're a pastor. I've been in ministry for years as well, and one of the things that we deal with even with ourselves in church is, okay, God will fix it. And so we feel like our faith is weak if we got to go to counseling, you know. But I love one of my professors said, well, what are we supposed to do, you know, when people think, okay, I just need to pray about it, or you just need, you know. And he said, well, tell them we're there for when the miracle doesn't happen. And I would say, rather than saying we're there for when the miracle doesn't happen, is that we're there to walk you through and to your miracle. God uses medical when the miracle is not happening instantaneously. I believe in miracles. I believe in healing. Yes. But when it doesn't happen, that's what all truth is God's truth. That's what we say at Oral Roberts. And so the medical professional, the doctors, the nurses, the nurse practitioners, all of the medical healthcare facilities, and the medicine, that is God. You know, so God uses all those things to bring us healing. And mental health is one of those ways to bring us healing. We deserve that. And so what I would tell anyone is that you deserve that. You may have gone through abuse, rape, child molestation. We talked about the racial injustice, political injustice, systemic racism, systemic things that are in all types of systems that are holding people down. You know, you're trying to build yourself up and pull yourself up by your bootstraps, but there's some things that are systemic, you know, that keep you in poverty. So, but we are resilient people. And so you deserve to take care of yourself, not only medically and get help, but mentally, mental health. You deserve. Don't let people oppress you any further. That's what I would tell anyone. Don't let people hold you back. Don't let that abuser continue to abuse you. Don't even let that abusive father, mother, or even that family system or family dynamic hold you back anymore. Don't be a victim anymore, and get that help that you need. So we're powerful people, we're resilient people, and I think that's another aspect of what we need to do, is to access ourselves to it. So I see a lot of people that are looking up African American workers, African American mental health providers online, and I'll ask them, how do you get a hold of me? I was looking for Black, mental health providers, and that you were the one, and so that is nothing to be ashamed of. We want ourselves. We want to see ourselves. We want to see ourselves in school systems. I remember when I was in my I don't know, my master's and my PhD program, and I had only 2 or 3 years in the program, and only one African American professor, and so we need to see us because we share similar life experiences, and so I hope that people will avail themselves to it, especially minorities, especially African Americans, because we deserve to make sure we get better. And that's for our families, that's for individuals. Families can come together and get healing. And so I think couples, relationships, when you're working with your partner, we all deserve to be healthy and whole. God called us that we may have a healthy, joy-filled, and balanced life. He came that we might have life and have it more abundantly. So hopefully people will join in and avail themselves to the health that they so richly deserve. So, yeah.
Thank you, Dr.
Okay. Thank you, Miss Sarah, Pastor Sarah. So I thank you again for you guys inviting us. If you have any other questions, feel free to give us a call. You can always access us with www.balancedlivingcounseling.org, and we would love to talk to you. Thanks.